trust that God knows your heart, right? Trust that God knows that you don't want to think those thoughts, that you don't want to do those things that are in the thought.
Stop assigning meaning and stop judging them.
A thought cannot make you do anything you don't want to do.
Welcome to Tea with Dymphna. I'm Elizabeth.
And I'm Lauren, and we are Catholic therapists in private practice.
We get together each week to chat about mental health topics from a Catholic perspective, hoping to spread hope for healing by educating and inspiring growth.
So grab a mug with your favorite drink and join us. Today we're going to talk about intrusive thoughts.
Well, Lauren, do you want to kick us off and tell us a bit more about what are intrusive thoughts?
Sure. Intrusive thoughts are thoughts that your brain is essentially generating in order to, they're attention grabbing. The point is that they would excite your nervous system and make you feel dysregulated and upset. The whole point of an intrusive thought is to kick your hindbrain into high gear and cause nervousness and excitement.
Yeah, and that's why intrusive thoughts will be very unwelcome, very appalling. Oftentimes they have content of hurting yourself or hurting others. Blasphemic thoughts are common. Content of sexual or pornographic nature. So they really, like Lauren was saying, they really grab your attention and they can be hard to ignore. And they're supposed to be hard to ignore. Intrusive thoughts are part of OCD. And the purpose of OCD is to protect you from something that your mind deems as too threatening to address. And it uses intrusive thoughts as a distraction. And what often happens is that people start to obsess about these intrusive thoughts. They will ask themselves, why did I think that? Do I want to think that? For example, a very common one I hear is new moms with their new infants. They will, for example, walk by a stairwell and have the intrusive thought of dropping their infant down the stairs. And they're very shocked and scared by the thought of, what does that mean? Do I want to hurt my child? And of course they don't. It's just that their mind knows that will grab her attention because that's actually the opposite of what she wants to do. Another example is somebody driving their car over a bridge and having the intrusive thought of driving their car off the bridge. And then again, this whole thought of, am I suicidal? And a common response will be to seek reassurance. For example, Googling like signs of suicidality. And because they have that big reaction to the thought, their brain says, oh, this must be very important. Let's send that thought again. So the next time the person drives over the bridge, guess what? They have the thought again of driving their car off the bridge, not because they actually want to kill themselves, but because they have given their brain the feedback, this is important, right? They have a big reaction to it. And then that gets solidified by now they're really worried about having the thought again. And so, right, they get into their car, they know their path has a bridge on it. And so they think, oh, I hope I don't have that thought. And by that, they're priming their brains. And of course, then they have the thought again. And now this person is really, really anxious and distraught of, I keep having this thought of driving my car off the bridge. What does that mean? And then there's a lot of anxiety around that thought, a lot of obsession of trying to figure out, am I suicidal or not? And oftentimes patients will ask me, okay, so if I don't actually want that thought, then why did I have it? And like we were saying earlier, it's because your mind is trying to protect you from something else.
Yeah, your brain is trying to protect you. And it knows that by generating this thought, it's hopefully going to excite judgment and generally shame. These are fear responses. And so the point of that is to, if you continue to feel shame and you continue to judge the thought as bad and deem it as bad, it just gives it more power to rule in your life. And the example that you gave of like you're priming your brain when you like, then the next thing that people start to do is like avoid bridges. And now bridges are scary.
Yeah, right.
And and now like and we've said this before, but like anxiety is one of those things that if you don't face it, it will bully you your entire life. It will just take over. So yes, a really good step to disarming intrusive thoughts is to take a stance that like, oh, this thought was just generated. You can have up to 60,000 thoughts a day. So just to take the appropriate stance of like, this thought doesn't necessarily mean anything. In fact, it doesn't mean anything.
Mm-hmm.
It's as important as what shirt am I going to wear this
Yeah.
morning.
If anything, it means that the thought that you had is something that you don't want to do.
Yes.
Because otherwise, it wouldn't be appalling. Otherwise, it wouldn't grab your attention. So if you have an intrusive, unwelcome, spontaneous thought, you could just tell yourself, that is something that I really would not want to do.
Yeah.
Right? So it really doesn't represent your truth and your values. The other really important thing to know about intrusive thoughts, or well, any thoughts, is that a thought cannot make you do anything you don't want to do. Like I can think all day long that I'm going to go out and run on the street in front of a car. I can think that 1,000 times a day. I'm still not going to do it, right? I hear that sometimes that people say, well, I feel like I have to fight the thought, otherwise it might become true. Or if it's a thought that they're like shameful of thinking, is like, if I don't fight the thought, does it mean I agree with it?
Right.
And to that, we want to say, right?
Absolutely not.
Yeah. And actually, it's actually impossible to push away a thought.
Exactly.
It's impossible, right? If I say, I don't want to think about pink elephants, if I say that, like, I can't help but think of the pink elephant. So what do you recommend to your patients? What should you do instead when you have the intrusive thought, instead of pushing away the thought? Do you have any recommendations?
I do. One of the things that I tell patients to do is just to say, this thought has no power over me. This is just a thought. It's passing, just like all things. I'll forget about it in time, because I can guarantee you there have been other phases of your life where you've had intrusive thoughts and you thought, I'm never going to get over this. I'm just going to keep thinking about this over and over again. And then you move on to a different, probably more like frightening. But the point is that you can take away the power from intrusive thoughts by taking the stance that this thought has no power over me, and it actually doesn't mean anything.
Right.
It's nothing.
Yeah. Right. Yeah. Yeah. It's basically you want to not react, right? As hard as that is, right? But when you have a thought that seems very scary, instead of asking yourself, what does that mean? Do I want that? You just notice the thought. Again, don't try to push away the thought, because pushing it away is also paying attention to it, right?
Exactly.
If I try as hard as I can to fight with that thought and say, go away, thought, I don't want to think you, we are still telling our brain, wow, this is important because, wow, Lauren is having a huge reaction to that. This must be very relevant. Instead, you want to respond the way you would to the thought of, for example, oh, there's a fly flying by, or where you're like, there's a fly. I'm probably going to forget that thought in 10 seconds because it has no big relevance for my life. And so you want to have the response of, oh, that was a silly thought. And just do nothing and go on with your day, resisting the urge to ruminate on what that means. And it might linger, right? Especially if it's a thought that really like grabbed your attention. It might linger, and that's okay. You always have the choice of not engaging, of not trying to push it away. This is one thing I like to tell my patients with OCD. You know how they say, don't just stand there, do something? With OCD and intrusive thoughts, right? I say, don't just do something, stand there, right? So you want to just notice the thought, let it wash over you, realize that it has no power, like you were saying, Lauren. And if you do that, not only is the thought going to leave your mind quicker, but your brain is also going to stop sending those thoughts,
right?
Because it's going to be categorized as, oh, this had no relevance. I mean, like you were saying, Lauren, right? Like 60,000 thoughts a day. Our brains are very noisy. There are a bunch of thoughts, and I guarantee you had most of the thoughts you had thought today, you don't remember. So for example, you probably had a thought today of like, oh, there's a fly, but your brain categorized it as, this isn't very relevant. And so you're not going to remember, it's not going to make you anxious, and your brain isn't going to constantly send, you see a little fuzz, oh, was it a fly?
One of the questions I have for you is, what do you do when you have a patient who has intrusive thoughts and they are deeming them as sinful, or they see them as somehow deeply spiritually problematic? What do you do with that?
Yeah, I see that a lot, especially in the Catholic patients that I have, that they'll have, say, a blasphemic intrusive thought, right? Intrusive meaning unwelcome, right? And they're appalled by it. And then there's that fear of, oh no, am I sinning? Which makes them even more want to push away the thought. And then, as we explained earlier, making it snowball into coming back more and more. To which I would say, again, you can't actually control the thoughts that spontaneously come into your mind. You also can't really override your amygdala, which the amygdala is that part of the brain that produces anxiety. So when your amygdala sends you a thought, you can't override that. Right? You can't prevent that from happening. So it's not your fault. Also, not reacting, like not pushing away, it's not the same as dwelling in the thought. Would you agree, Lauren?
Yes.
Like dwelling is like taking pleasure in the thought, right? But you're just trying, your best not to freak out by the thought, right? So you're not enjoying the thought, you're not dwelling in it, but you're realizing that you cannot push the thought away. And the fastest way to make the thought disappear and not come back again is to not react, to just let it sit there, not do anything about it, waiting for it to just taper off. And that's not a sin, right? Would you have anything to add to that?
I don't think I do have anything to add to it.
Mm-hmm.
Just that the initial reaction, my guess is to us saying that, articulating this whole thing, is that, well, by just sitting with it, then I am agreeing with it, and then what if they're wrong, and then there's going to be... So I just want to speak to that too. Like, this is one of those moments where it's maybe best to trust somebody who has experience doing these things, and I've worked with many people, I'm sure you have too, Elizabeth, and so that really find a lot of relief from their symptoms by sitting with the very thing that makes you the most uncomfortable. So as you begin to sit with these thoughts, you likely are going to have thoughts that say, this is wrong, even this what you're doing, just sitting with it, even though those people don't know anything.
Right. Or maybe are you enjoying these thoughts?
Yeah. Oh yeah, yep. How do I know I'm not enjoying these thoughts?
Yes, right.
I'm freaking out right now, but how do I know I'm not enjoying them?
Right. What if I'm in denial? Yeah.
And just
that's your OCD, right? Exactly. Right there. That's your inability to tolerate uncertainty. Go ahead and watch our video on scrupulosity because we talk all about that.
Yeah.
In that video. The thing also to know about the intrusive thoughts is that, again, the reason why you're having these thoughts like the blasphemic or like pornographic content is not because you want to think those things. It's because it's what your mind is picking as, this is going to distract my person. And so obviously you don't want to think those thoughts. And trust that God knows your heart, right? Trust that God knows that you don't want to think those thoughts, that you don't want to do those things that are in the thought. Like God knows your heart. So trust that He knows that you are doing your best to get rid of these intrusive thoughts, and that you're not wanting to dwell. And He's made your brain. He knows that you can't push away thoughts. He knows that you don't control all the thoughts that spontaneously pop into your head. So He knows that. So trust that He is gracious and wants your salvation.